Hello everyone, welcome back to Geo 360. Today, in the Emergency Management First Aid video series, I am going to create awareness regarding the first aid for burns. Burns are the injuries to the skin and the underlying tissue that result from the sun, heat sources, fire, hot items, boiling liquids, chemicals, radiation, etc. However, an interesting fact is that cold can also sometimes lead to burn wounds. Actually, burn wounds are classified into three types based on their severity. They are the first, second and the third degree burns. Before explaining them, I would like to make a point clear that the skin is usually made of two layers, which is the epidermis and the dermis. Epidermis is the uppermost layer of the skin and the dermis lies below that. Okay, now first we'll see about the first degree burns. These are superficial burns in which you can see redness or darker skin than the usual skin, slightly swollen skin, and sometimes pain will be there, but mostly it is bearable. These burns actually don't get into the dermis, they only limit themselves to the epidermis. Then the second degree burns. These are intermediate second degree burns and they show the following symptoms. They show blistering, swelling, and they are very painful. These burns usually involve both the epidermis and the dermis. Finally, the third degree burns. They are very deep burns and they show black parchment like or white looking burn wound, mostly dry, no pain inside the third degree burn area but very painful in the surrounding second and third degree burn part of the skin. Then burns are classified based on the origin, that is the source which produces the burns. They are the dry burns, scalds, electric burns, chemical burns, radiation burns, frostbites or the cold burns, and finally the sunburns. In this video, we'll see about the first aid for all these kinds of burns one by one. Before explaining about the first aid for all these things, I will also like to mention the complications of the various degrees of burns. The most common complications are the infections which occur in most of the burns. Infection may also lead to sepsis, which will further lead to the organ failure and death of the person. Low blood volume may also occur. This occurs because the capillaries are ruptured during the burns and the blood loses from the body, so the amount of fluid in the body will get reduced, so you will go into a state called shock where the heart can't pump properly to compensate the body's needs, and finally it leads to the death of the person. And then next is low body temperature. Actually, skin is the regulatory organ which maintains the temperature of the body. So due to large burns extending over a large area of the body, the temperature of the body may also drop and it leads to hypothermia, where the body of the casualty loses heat faster than the normal condition and it leads to low body temperature called as hypothermia. It may also lead to breathing difficulties, where the casualty usually inhales the smoke or hot air which may burn the airway and making it difficult to breathe. Smoke can permanently damage the lungs and lead to respiratory failure. Pain is a very common complication and the burns cause pain which are undescribable and which are very much intense. Finally, it may also lead to disability. Burn injuries from the scar tissues once healed when the skin is burnt. The surrounding skin starts to pull together, resulting in post-burn contracture that prevents the movement. Deeper burns can limit the movement of the bones or joint when the skin and muscles or tendons shorten and tighten, permanently pulling the joints out of the position. So it leads to the disability of the affected casualty. First in line, I will explain the first aid for dry burns and scalds. What are dry burns? Dry burns are which occur due to the flames or due to contact from the hot surfaces or due to friction. Scalds occur when you pour some hot liquids onto your body surface like tea, coffee or hot water, whatever it is. First of all, how to approach the situation. You have to observe the following things: that the casualty has first or second or third degree burns. In case of burns to the face or inhalation of hot air or smoke, you may also observe soot around the mouth or nose, scratched eyebrows, eyelashes, mustache and beard or hair. First of all, make sure that the situation is safe for you and the casualty, and then enter into the rescue procedure. Shout for help and call for emergency help before entering into the room where there is fire. Actually, the firemen are equipped and trained to rescue the people, but in some situations you have to rescue the casualty and provide him first aid. In such situations, make sure you have already called for the emergency help. Have a wet kerchief around your face. Crawl along the floor to reach and pull out the casualty by crawling around the ground. This must be done as most of the clean air is along the ground surface, so that you won't smoke any toxic gases and get intoxicated. So you have to crawl around the ground and pull the casualty outside and rescue him. Move swiftly and quickly because there might be some amount of carbon monoxide also in the room. Do not open the other doors and windows of the room, as it may let in fresh oxygen from outside and increase the fire. If the person's clothes are on fire, stop him from running around, douse the fire with water, approach him and cover him with a thick blanket and set the flames off. Make the person roll on the ground to also control the flames. Cooling with water will prevent the burn from getting deeper and will also reduce the pain. Pour water on the burn for 10 to 15 minutes until the burn stops hurting. Do not use very cold water for cooling the burns, as burns victim can easily become hypothermic. Protect the burn victim by wrapping him in clean blankets. Cover the burns with a clean cotton cloth. Do not open the blisters and leave them intact. Remove any clothing or jewelry that is not stuck to the burned skin. Do not remove any parts of the clothing or jewelry that are attached to the burn wounds. If possible, remove the person's belts, shoes and boots, as the limbs might swell. Keep the casualty warm but do not overheat him. If possible, keep burned hands, legs or feet in an elevated position. Do not leave the casualty alone and keep observing him. Observe his breathing and pulse rate if possible. If the person is breathing and loses consciousness, put him in recovery position. In the second case, if the person also stops breathing and is unconscious, perform CPR on that person. If you don't know about these procedures, watch a previous video regarding the recovery position and how to perform CPR in case of emergencies. Even in case of minor burns, refer the casualty to the emergency as soon as possible, as it may lead to complications. Now, I would like to give some additional tips for the first aid for minor burns. In case of minor burns, you may also apply aloe vera and honey over the burnt area, as it may help in healing the wound faster. Touch the wound with a clean cotton cloth. Do not apply any medicine, cotton wool, Vaseline or any paste and cream over the burnt area until it is prescribed by a registered medical practitioner. Make sure that the burnt casualty has sufficient fluids to drink and refer the victim to the healthcare facility for further management. In case of burns to the eye, rinse the eye immediately with plenty of water 10 to 15 minutes, preferably from the nose outwards. Make sure that the liquid is not too or cold. The liquid is at room temperature is always the best choice for cleaning the eyes. If the person wears contact lenses, make him to remove it if possible and then transfer the casualty to the healthcare facility. Do not put on any medications into the eye unless it is prescribed by a registered medical practitioner. In case of chemical burns, the chemicals may irritate, burn or penetrate the skin and cause damage and sometimes even death. In such cases, you have to definitely protect yourselves primarily by wearing gloves or a plastic cover over your hands. Remove the cause of the burn by first bruising off any remaining part of the dry chemical over the area and then rinse the chemical off the skin surface with cool and gentle running water for 10 to 15 minutes. Remove any clothing or jewelry, wrap the burned area with a clean cotton cloth and then refer to a healthcare facility. Next, what to do in case of sunburns, heat exhaustion and heat stroke. Sunburns occur due to direct exposure to sunlight. Reddening of skin, warm skin, swelling and blistering of the skin are the common symptoms. Heat exhaustion occurs due to prolonged exposure to high temperature and inadequate replacement of fluids. Here, heavy cramps, paleness, sweating, weak pulse, headache and dizziness may occur to the casualty. Heat stroke results when the body's temperature is increased due to impaired stretching. The symptoms are usually same as that of heat exhaustion, with an additional body temperature of 40 degrees Celsius and above it. The first aid for these conditions are: bring the casualty to the shady place and cover him with a light towel. Cool down by light showering for 10 to 15 minutes and encourage the casualty to have frequent sips of cold water. Ask the casualty to rest by lying down with his legs slightly raised. Thank you for watching the video. Hope this was very much informative and useful. Like, share and subscribe our channel and stay tuned for further updates. Thank you.